live.
We're live. Noswaitha, Chroesoiki. Good evening, everybody, and welcome. Thank you so much for everyone attending this evening, and I'd also like to extend my thanks to Low Lounge. Thank you to them. They're kind of friendly, they're police wary. So we just ask you, if you are going to medicate in the designated areas, and if you're going to smoke cigarettes, to dispose of your cigarettes butts responsibly. So I'd like to kick off this evening by explaining what we're all doing here today. Back in 2018, on November the 1st, legislation was changed so that consultants on the specialist register can prescribe cannabis-based medications. This legislation was sort of pushed through because there were mothers who were campaigning for their children who desperately needed this medication to help manage the symptoms of epilepsy. And this evening we're going to be hearing from Rachel Rankmore, Bailey's mum, who's going to be telling us about her experience. And we also have a raffle this evening, some fantastic prizes. We have a Mighty Medic, and we have some wellness products sponsored by Welford Clinics. So please dig deep, buy some tickets, because all the proceeds are going to be going to Bailey's mission, and that is going to be for his medication so that he can live the full best life that he possibly can. They cannot get this medication through the NHS, they have to pay for it privately, and so we just hope that we can put some money their way and make it an easier month. This is really important to me personally. I speak all the time about being a patient and about how cannabis has been absolutely fantastic at managing my symptoms of Crohn's disease and menopause. And it has been something that has allowed me to be present in my life with my family and with my loved ones. This week I had to read something my daughter wrote. She did an application to uni and she had to say, what was it that inspired her? And she said the thing that inspired her was seeing how difficult my life had been when she was little, and seeing how cannabis had made it so that I could be present in her life and do all the fun stuff that we do together. And that's what it's given us, and that's what it's given my family. So this is really, really important to me. I'm really passionate about this, but I'm not the expert, but I have on hand someone who is. So I'd like to introduce my husband, Dr. Dave Howells, consultant psychiatrist at Cannabis Clinic Cardiff, and I'm going to allow him to introduce our wonderful panel and let him take on for the evening. Thank you very much. Have a good evening.
Welcome, Sam. And Croeso Cymru, for those of you who have come from across the border, it's a pleasure to be here to speak to you today and have a panel of such fine and educated people who know an awful lot about medical cannabis, and this is why we're all here. I know that the audience we have tonight will probably contain people who are already using medical cannabis, some who have never heard of it before, but we hope that we'll get things out there that will be of interest and value for everyone. There is going to be an opportunity to ask questions, so please do so. Well, first we're going to go piece by piece through our panel here, and that'll give you a little bit of a synopsis of who they are and why it's interesting and what their role is in this area. And then we'll ask a few questions, and then we've got about an hour, which we'll then sort of wrap up. But feel free to ask more questions later on. We're around for a while, and we want to know what's relevant for you. So I'm Dr. David Howells. I'm a consultant psychiatrist, and I'm co-founder with Sam of Cannabis Clinic Cardiff. On the end here we have Guy Coxall, and he's going to introduce himself and the work he's doing. He supports patients in a lot of sort of the legal areas, so that'll be interesting. We've got Rachel Rankmore, who we've heard about, Bailey. We've got Leon, who's one of the patients at CCC, who's very kindly agreed to speak to us, and Alec, who is another patient, and they've both got really interesting stories, and feel free to share as much or as little as you wish, but we will talk around this subject. And Umesh, who's kindly come from London, who's the Director of Specials Pharma, and in my opinion, certainly the finest pharmacy supplying medical cannabis in the UK. So thank you all for coming, and can we have a round of applause for our panel? So to start with a very simple question for Umesh, I'd just like to ask, what is medical cannabis?
Thank you. Yeah. So I think the definition really is that it's gone through a different process. There's a lot of safety checks. So part of my background, not only as a specialist farmer, I'm also an RPQA for a lot of importers. So I do what's known as batch release. And batch release requires me to check the product. So we do look at their COAs, which is their certificate of analysis, and within that, for it to hit a medical grade, it's got to come in within some of the EU GMP, good manufacturing practice parameters. So it would be very low on, say, arsenic, lead, stuff like that. In terms of your yeast count and your bacterial count, it's got to be below the limits there. It can't have things like Salmonella, Shigella, and probably worse still is E. coli. And if anyone knows anything, E. coli only comes from one thing, and that's fecal matter. So, so when you do talk about medical cannabis, and as a pharmacist, we will talk about quality, meaning is it safe for the patient? Yeah, and sometimes I think we forget that also for the patient, quality also means what does it smell like, what does it taste like, But for us, the quality means, has it got the potential to make the patient more ill or not? Yeah. So for us, that's medical grade because we've now, and I think it was about 3 months ago, the EU June, I think it was end of June or early July. We now have what's known as a monograph, an EU monograph on cannabis. So basically a monograph is, you get that for every drug. It's literally the sort of Bible to say what you need to make this a medical product. And I think that's probably the difference.
Fabulous. Thank you. It's important to know the safety profile of cannabis, definitely, and compared to non-medical versions. I'd like to go to Rachel next and just say you've been here firsthand examining the medical market. You've been using it for an awful long time. You've probably got more direct experience than anyone in here about the evolution. So can I just ask you, what did the change in the law mean to you and Bailey, and has the promise met its expectations?
Oh, that's a really good question. How long have we got? For Bailey, our journey started in 2016, really, when we had a chat with a friend of ours who said, if we try medical cannabis for Bailey's epilepsy, because we came to the end of a line of all his medications that we could try. There was nothing left to try. So while we were awake at night dealing with Bailey's seizures, Craig always researched and had a look, and we came across Charlotte's Web, which is hemp from America. We sourced that from down in Kent, drove down, got the bottle, and instantly, within a few days, we started seeing improvements in Bailey's epilepsy, all his faculties, his speech, everything. So from there on, for 2 years, it was great. But he plateaued on that. He's got a severe form of epilepsy, intractable, so lots of drugs work, and then it reaches that period where he needs to try something different. And then we came across the campaign in 2018. We were one of the families that pushed over the law to be changed. Lots of hard work and hoops to jump through. And we thought that day, elation, great. We're going to get Bailey's prescription, which contains CBD and THC, because we needed that for him. That was his next step of getting his life back, basically. So when that law was changed, we thought, great, this is it. We can get back to living our lives. Sadly, it wasn't to be. And that's when our world fell apart, because we couldn't get an NHS prescription then. So we then started Bailey's Fund, Mission for Bailey Shakes, where we started fundraising to get a private prescription through Portland Hospital. There was no clinics then. And once the first clinic was set up, medical cannabis clinics in London, we fundraised £7,000, so that started us off on Bailey's journey with that, and that's a lot of money. I mean, we're talking it was £2,000 a month then. So one, we
And
didn't.
this is ongoing.
And this is ongoing.
Yeah, yeah.
I mean, back then in 2018, you're talking fees to pay for an appointment to start off with, and then the importation. There was no importation then. There was no importation. There was only one prescriber for children, and she was getting inundated, as you can imagine, because the law change was supposed to be for our kids, and sadly it wasn't. So it's only a selected few in the UK and Ireland that have actually got a prescription on the NHS. So basically from there on, it was families like us who pushed the law to be changed, have basically been left behind. You know, and we've set up all the consultations for importers, the pharmacists, all things, all the sort of guidance and regulatory things was set up by families.
So do you
like
feel
us.
that actually where we are now has anything changed significantly?
I mean, it's changed for pain and anxiety, MS and things
Mhm.
like that. I think it's still in the private sector, which it shouldn't be in the private sector. It's meant to be prescribed on the NHS for the likes of, you know, not just for epilepsy, but I'm gonna say for epilepsy because that's our situation. Bailey's never gonna get better.
Yeah.
He's gone through over 20 pharmaceutical drugs that have failed to work for
Yeah.
him. He's got more side effects from them that has put him in HDU and ICU. So
And access via the NHS is definitely something I want to come on to, but thank you for sharing your story there. And could you pass the microphone to Alex there? And I say we just want to get brief comment from everyone, then we'll sort of dig into some of these issues deeply, but thank you for sharing that. So Alex, can you give me a little bit of sort of summary on your sort of experience, and what's it been like getting a medical cannabis prescription?
Actually more straightforward than perhaps I thought it would be. Initially there was a large barrier up to it, perhaps because of the situation I'd just come from as co-founder of In the Welsh Wind Distillery, and actually we've been so busy through lockdown, as I had perhaps a breakdown and discovered some difficulties there. In order to try and move forward, I needed a diagnosis which did come to me for bipolar, and had tried 3 different pharmacological medicines as a result of that, all of which had horrendous effects and horrendous long-term possibilities as well. That a kind nurse had suggested to me that I would get in touch with actually with your clinic as a direct recommendation. Now, the process there was 2 weeks,
Right.
perhaps, from first contact to sharing my medical history and other details for an agreement to be made that I would be suitable, to then getting in touch with the pharmacy to set up my account, to then receiving my CPNP. Everything happened within a 4-week process, and then actually beyond that, the results have just been fantastic. Coming from a place of breakdown, agoraphobia, insomnia, poor diet, wavering states of difficulty as a result of the bipolar, to all of a sudden feel some relief from something that allowed me to sleep and rest and feel nourished, has allowed me to then repair and build everything that I wanted to and had no possible way of doing that. So, sleep is a massive aid to anybody that's feeling uncomfortable.
And it's amazing how many patients I see who said, well, I don't know if the cannabis has helped me, but heck, the sleep has.
Oh, yeah. Well, that's a clear indication that things are working.
Yeah. Okay, and if I could bring to Leon, as I say, Leon, could you just tell us a little bit about your story and what advice would you give anyone who's looking to get a medical cannabis prescription?
Yeah, sure. Thanks, Dr. Dave. Sorry, I'm having some trouble with the mic. My name's Leon. I've been a patient at Cardiff Cannabis Clinic for probably a couple of years now, and I went along there for a few different reasons, really. The first thing was to try and find something which would help with the anxiety and insomnia that I had, which was a result of having kind of long-term physical health issues. I have several ultra-rare diseases. I'm not going to go into excruciating detail, but basically these were kind of autoimmune in nature, and it destroyed a lot of my muscle tissue, similar to muscular dystrophy. The condition I had was called juvenile dermatomyositis. And the other condition that I had was called lipodystrophy, which is where the body destroys its own fat tissue. So I probably weigh about 8 stone and I look pretty slight, but you know, when you have different rare diseases, one of the biggest challenges, I think, is the long-term prognosis. You just don't really know what the future will hold, and because so few people will have them, it's almost like the anxiety becomes an inherent part of your lived experience with the disease. And that was something that I'd struggled with for probably decades, if I'm being honest with you. I tried different antidepressants in the past, and they did not work well in terms of different side effects. Oh, the microphone's on now. And basically, it was then a question of actually trying to find something which was going to deal with the psychological symptoms that I had as a consequence of the different physical conditions that I had, and it was an absolute game changer for me. And I think going back to the specific question from Dr. Dave, I just recommend that anybody who thinks they might be eligible, if they've tried you know, 2 or more therapies which have failed, then for God's sake, try medical cannabis. It's legal. You know, there's nothing to stop us from doing it. It's been legal for 6 years. It's regulated. There's a lot of evidence there that it works. You've got nothing to lose. And I think that from my own experience, if it works for things which are really, really rare, then if it works for me, it can work for anyone.
Fabulous. And at the end, Guy Coxall, I say you're not necessarily wedded to the medical model. I know that you've got fingers in lots of pies, but could you just introduce yourself and some of the work you're doing, and could you just pass comment on the medical model as it fits in with your world?
Yeah, of course. Thanks, Dave. Yeah, I mean, you've got to realise that cannabis has been used for 5,000 years as a medicine. It is the oldest recorded medicine in history, going back to China. You know, there's lots and lots of anecdotal evidence of cannabis used for over 100 different diseases and conditions. But it's only really in the last 100 years that cannabis has actually been vilified and prohibited, not just in the UK but globally. So, you know, I think you hear the stories that we've heard here, and you know, I totally commend you all for like what you've had to go through and everything. Cannabis is just the most amazing product out there.
So what do you do then?
What do I do? So yeah, I've been in the industry for about 8 years. I started off in the CBD industry from a regulatory perspective, and then I set up Seed Our Future back in 2020. So that was more of a campaign organisation to challenge the legislation. Because if we actually look, you know, the reason cannabis is in a Schedule 1, Schedule 2 status is actually based on perceived harms. And this goes back through history, through propaganda, and the truth is cannabis is actually a very safe and effective drug, as all these people are realising. You know, so what I'm trying to do is challenge the legislation, but also support patients. So a lot of patients have had trouble since the legislation 6 years ago in regards to the police not being aware of the legislation, being arrested for different things like possession, driving. So I've been helping them, really filling in the gap and helping them with their court cases and things. So yeah, that's basically what I do.
There's still an awful lot of stigma out there, and I don't know whether you want to take that and whether anyone else would want to chip in about, you know, why is it that there's still so much stigma about medical cannabis or cannabis in general?
Well, we've had 100 years of prohibition, so you know our grandparents would tell you cannabis is dangerous, cannabis is a narcotic. It's generational stigma and discrimination. And this carries on, and it's everywhere in society. So people are getting problems with work, people with housing associations, councils, all these people who have these ideas that cannabis is a dangerous drug rather than a medicine. It's always been a medicine, and really education is key in preventing that discrimination and that stigma.
Has anyone here experienced discrimination? And absolutely anyone?
Not necessarily direct discrimination, but this feeling that I have that having built a business with my partner, how on earth do I go and explain to people now that I'm a Welsh drinks producer, and the freedom that surrounds alcohol and the way that it can be purchased and consumed, and its legitimacy, but also, potentially the things that can damage and hurt you as a result of using that, and you weigh that up against the scenario I have now, that I can actually say that I'm out of the disaster that I was in, and I'm putting pieces back together, and I'm functioning and having this, having this opportunity to enjoy my family and as such. But I still don't feel that I could go and tell lots of my friends or other people. This is a big step, obviously, coming and talking with other people on a panel, and actually saying, well, look, I'm using this. I feel it's safe. The benefits are extraordinary, for my issue with bipolar and other associated mental health. That I would like to be able to discuss it more and talk more openly about it, but I just wonder what people would say, and could that have a negative effect in other areas of my life? And I think there's a level of confidence that you have to find, isn't there?
Do you think that cannabis consumption, whether it's in medical vape lounges like Jay's in Newport, or whether it's on a more sort of social level, do you think that could ever happen? Could that take off?
Well, if we look at the number of people that have a prescription in the UK, and does it sit around 50,000 at the moment, maybe, or loosely, in areas of conurbation here like Cardiff, perhaps that could work, but it wouldn't be serving lots of people. I'm from a rural area further up the coast, Cardigan, so just south of Aberystwyth, and there just wouldn't be enough foot traffic for that to work. Perhaps I'd love to see it, and I'd love to attend, and perhaps have an experience of that, but doesn't it also balance with, it would feel recreational then, perhaps? And for me, my attitude is this is very much a medicine, and I use it approximately 5 times a day with some fluctuation, and feel that I want to control that, and control actually the product that I'm taking, whether it be an indica or a sativa, and I put a lot of control over wanting to maintain that stability, and changing the times that I would use my prescription to suit a social engagement. I don't know, but perhaps that might not work for me.
Okay, I mean, you said that, yes, we're here to discuss medical cannabis, and we perhaps blur the line between what's medical and recreational. And there is a growing opinion within certain quarters about pseudo-rec use, and I don't believe that exists. Medical use is medical use. If you've got a medical prescription, it is medical. Guy Coxall would like to chip in there, and then I would like to come to Rachel and ask her, what would it mean to get an NHS prescription, if that's okay?
Just going to the recreational versus medical, as I said, cannabis has been a medicine for over 5,000 years. It's always been a medicine. What is recreational except for a term? People who use it socially, that might be to get rid of social anxiety. So people who go out and feel more comfortable speaking to people who have used cannabis generally makes you happy and relaxed. So people with mental health problems probably use cannabis so-called recreationally, but they're actually using it medicinally. Also, everybody has an endocannabinoid system, which relates very much to the plant. So even if they're not actually using it for a specific condition, they're actually enhancing their overall health. So I don't think there is really a thing as
that's not really taught in med school. Absolutely not. That there is an endocannabinoid system. No. But if I ask Rachel, what would an NHS prescription mean for you? And then I'd like to go to Leon, because I know you've got a research background, and I want to ask you a little bit, what about the evidence? What would it take to actually get it to be an NHS prescription? So, Rachel.
I mean, like we said previously, back in 2018 we thought that was it, and then we came down from the fact that it was there was lots of barriers after that we had to face to get, to get it through. And still to this day, we still experience barriers. Locked down to education, like, physicians are not, given that as a learning tool. But for us, I don't know if Bailey's going to get that in an NHS prescription in his lifetime, because I think we're so far behind in lots of areas. One, with the trialling they've got going on now next year, it's to me it seems as it's doomed to fail, because they're isolate CBD and THC, and our children are taking the full sort of ingredients.
Why wouldn't the isolates work as well as the full source?
Because with people with epilepsy like Bailey, all the minor cannabinoids is what makes it work for them. And each prescription, as you're well aware, every prescription is different for every patient, so it's very personalised. For Bailey, he tried Epidiolex during lockdown because we couldn't get our importation from Israel for his oil.
That's the CBD isolate.
So it was a CBD isolate, but it also had lots of other chemicals in there. To actually make it pharmaceuticalised, because they can't, pharmaceuticalise a plant. So, that, it didn't work well for Bailey. He was allergic to the ingredient in it, the colourings and stuff like that in there. So for Bailey, I don't think the UK yet are there with that.
Okay, so you can't see it happening anytime soon.
No.
That's
I mean, great if it does, because we fundraise so hard. I mean, we spent the last sort of 10 years fundraising for Bailey's Medicine, and we can't stop fundraising because we know the quality of life he has with his medical cannabis oil. I can't take that away from him.
Well, to be sort of a brutal clinician, that's an anecdote, and the plural of anecdote isn't evidence. And so I'm going to ask Leon a terrible question. So what do we need to do to get this to the point that we've got enough evidence?
I mean, I think it's a really, really tough question, actually. In part, it's because of the process that you actually need to go through for stuff to be approved on the NHS, and the sort of trials that need to have to be done. And the problem is that the gold standard for these things are so strict that it means that any sort of research trial is going to be incredibly complicated. The reason for that, as you were alluding to, is because the issue, if you imagine as different patients, we may find that different strains of cannabis will work for us depending on our condition. And so when you consider medical cannabis to be an umbrella term, effectively, it's actually something which is very, very general. And when you're thinking about doing clinical trials, actually what you need is something really, really specific. You need to be able to say, we're using this particular substance and we're going to be giving this compared to a placebo to 2 different groups, and then we need to formally assess, based on whatever measure we're using, whether or not the medical cannabis thing that has been tested is shown to be significantly better than the placebo. But the problem is, as we've already said, when we put in for our prescriptions, there are all sorts of different strains out there, all sorts of different terpene profiles. And so effectively, for this to actually have any sort of future in the NHS, it would probably have to go back to the pharmaceutical industry, where you would just be prescribed a generic THC or CBD pill. Now, to me, that almost seems slightly perverse, because you're losing all of the additional benefits that you get from the additional terpene profiles. And so I think that that's probably the biggest challenge that we're going to have. I think in terms of research in the future, now my background was more in the field of genetics, and so what I'd like to actually see in future, although whether this will happen I don't know, is actually look to see what different strains actually work for different people. So it needs to be more on a kind of genetic level in terms of working out what the kind of the underlying biology is that is unique to each person, which may then inform which terpenes or combination of terpenes or strains that can then be used. And I think that there's so much individual variability there that it's actually going to make it quite hard to know what's actually going to work and how this is actually going to be fed through to the NHS.
So that sounds like a phenomenally large project. You're not planning on taking it on?
No, to be honest, I think the best thing that we can do is just be happy with the fact that it's legal And we know that the evidence shows, anecdotally, from a large number of people, that it actually works. And hopefully in the future, what we will actually start to have is evidence showing how and why it works in different people. But I think that the evidence that will come in the future will be, so I'm kind of waffling now, but it has, basically we know that it works, and what we need to do is try and get the studies and the evidence to say how it works and whether or not that can result in some type of different
So
in the future.
I want to bring it to Umesh, and I know Guy's always got something to say. So we've heard that, yes, anecdotally it works. We've heard this been used for thousands of years. We know that there's lots of research to do. We're in the situation where the NHS aren't going to touch it, but we're in the situation we're in. We're in private clinics. That's how you get the medicines. It's brought in through clinics like yours, and yet, you know, there's a lot of patients online who still are not happy. This is not a perfect model. You know, for anyone who isn't sort of familiar with this, there's stock issues, things going in out of stock, there's complaints about the quality, there's complaints about delays. Christmas is coming, and if anyone's in this industry, they know what that means. Everything goes crazy. So Umesh, what are the problems from, you know, being in the industry, and how do we solve them if we can?
I think the problem will resolve itself at some point. I think one of the clear problems is that the supply chain is very fragile. Companies that are bringing in product aren't looking at continuity of supply. They're bringing in product to see how it's going to fare in the UK market before they start bringing in a continuity of supply. Now, you've got to understand when you're ordering medical cannabis, there is a long lead period, yeah? There's probably about 4 months, you know, from growth to the fact that it needs to be analysed, it needs to be dried, cured, then there's it needs to be analysed, and then it needs to go through what we call GMP Part 1, which is final packaging, before it's even imported. So you could be looking at 5 months. Now, if you brought in stock and it's gone out in month 1, you've still got another 4 months before you're going to get that same stock coming back in. So I think one of the problems is that fragility. Now we're seeing certain, I'm not going to say the product names, but certain suppliers who have managed to figure it out. If they do go out of stock, they're going out of stock for 1 or 2 weeks, but generally they'll have a new stock in before the old stock comes out. And I think the real reason why people are a bit worried about ordering is that when you do order, you're talking about, you know, 70,000 to 80,000 pounds a batch. Yeah, I mean, unless you're big pharma, and we hear this from a lot of patients, oh, big pharma's involved. Well, no, actually, most of the people that are involved aren't big pharma. You know, so you know, it is that problem that, you know, people are a bit weary. They want to bring strains in. Some strains actually just fall by the wayside. As I said, I'm an RPQA for a couple of companies. We had a strain where the whole batch, nearly £100,000 worth of drugs had to be destroyed. So, you know, whoever brought that in took the liability. So these are obviously concerns. I think the other reason why there's delays, and this is sort of an internal issue, yeah. There are loads of hurdles when I receive a prescription. So, you know, I know patients will go, oh, you know, I'll get my paracetamol, and you know, it's on the shelf and it's there the next. It doesn't work that way. So there are a huge number of hurdles, and I think coming back to something about the law being changed. Now, I'm not a lawyer, but I suspect when the law is being changed, there's probably some guidance, you know, 100 pages of guidance about how it would affect housing, how it would affect the NHS, how it would affect the police, and all the various laws of the land, and how it worked, you know, with some of the government agencies. This law was changed in three sentences, 4 sentences. So in the last 4 years, we've had all the agencies actually providing advice that's quite, you know, it actually contradicts each other. We find that there is right now I think the MHRA doesn't like strain names put as part of the, And yet the farm sock says you do need to have strain names in there so that you can identify what you're giving to the patient, you know.
So there's huge contradictions, and I know that people are chomping a bit. I know Rachel, I know Guy, we're chomping a bit there if you're happy to see the mic there.
Yeah.
But thank you for that. And I do want to ask if there's any questions in the audience. You know, if you do want to start putting your hand up, we will try and get this one. If we go to Rachel and Guy briefly, if there is anything, then the lady.
20 minutes left on
The
the live.
problem of not being able to get cannabis on the NHS, and therefore it automatically cuts a lot of people out of the possibility of even having
Right, so because people can't get the cannabis on the NHS, it cuts a lot of people out of being able to get it because they can't afford it, yes.
What about the idea that if you qualify for a prescription, you know, and you have a prescription, but you can't afford it, you have, your prescription could be used as a license to grow your own.
Okay, so if you've got a prescription or eligible for one and you can't actually do it because of financial reasons, that should be authority and permission to grow your own.
Yeah,
I think
mean, obviously
that's another 3 lines that would have to be added to the law.
The thing is, there would be questions about health and safety regulations, so, you know, like
And
you have your boilers served every year.
I'm
You have your
entirely
road
sympathetic
service
to that, and I think, you know, again, Guy would be, you know, so chomping at the bit, but I think we have to restrict this to what is medically here at the moment, and that's something we can talk to you later about. You know, we do have strong opinions about that as well. Okay, so Rachel.
Yeah, just going back to the conversation then, when they passed the law, they basically didn't enact it. It was just changed to quieten down our sort of campaigning that was there at the time, because it raised the roof on the whole of the movement really. So I think that was the stumbling block for the government. The Home Office never set up anything, they didn't know what to do for the importations. You got the MHRA, you got the NICE guidelines, which then had to be changed because it wasn't favourable. And they're the blocks that we've got to overcome with that. And again, it's down to evidence, but there's lots of worldwide evidence available for them to look at. Dame Sally Davis, at the time of the law changed, she saw evidence and wrote and actually said there is evidence to say that.
I think we are incredibly UK centric.
Yeah, we're just a bit.
Yeah,
I'm
so
gonna say it anal, really. I think a lot of the governing bodies
it'd be
are
fascinating to be drawing some of that in, and you know, who knows? Perhaps Trump will be all our saviour.
Just to carry on the conversation, really, I mean, cannabis is illegal. Well, it was illegal. The legislation was changed, as you say, for kids with epilepsy. It was public opinion, public outrage that actually changed it. They didn't expect a private medical market, especially with things like flour. They expected things like Bedrocan, like oils, and they weren't expecting it. And you know, this is where things have gone wrong. Also, the MHRA, if we go back to the MHRA and licensing and things like that, how many pharmacopoeia drugs are actually natural? None.
Yeah, we don't like that.
The only one is cannabis, which is a full plant extract, which creates the on-charge effect, where you have all the cannabinoids, the terpenoids, the flavonoids, that all work synergistically together. That's what makes it medicinal, which is why things have gone wrong with some of the GW pharmaceuticals like Epidiolex. And
do you think it would be more acceptable to the wider public if, you know, oils were promoted more than flowers? At the moment, I think there's a lot of legacy community coming into this area who are used to flower. But maybe it is time
I think
to...
both need to be used. I mean, you know, oil is very good as a, like say, for a pain condition, a background anaesthetic. It can last for several hours. But if somebody needs an instant hit, they're better off vaporising a flower. And that's the difference between an oil and a flower. You know, you can't really keep them the same.
No,
it's to do with the actual...
But just thinking in terms of the acceptability, so, you know, does anyone have anything they want to say about, you know, how can we make the image of medical cannabis more acceptable? I think if it was called something other than cannabis and it just came on the scene now as an endocannabinoid modulator, it'd be different, but it's not. It's called cannabis. It smells like cannabis. We've all had the stigma bound into us. Does anyone have any ideas about how you would make this palatable for your Middle Englander?
Can I just quickly?
Yeah.
I think we got rid of the propaganda in the media, which is still ongoing and has been going on for 100 years. That would help. I think if the government actually admitted to their mistakes and their lies about the harms of cannabis, which is it should never be been a Schedule 1 drug, which means it has no medicinal value, is highly addictive, highly dangerous. All of that has been disproven. If cannabis was actually regulated to the correct amount, none of these issues would exist. Everybody would have access.
And I think, yes, we can shout at the government, but they keep changing. It's not the same people all the time. So we can't identify people, it's a system, but we can identify individual victims of this policy.
The people working in the Home Office don't have a 4-year lifespan.
Okay. Anyway, does anyone want to say anything about how to make this more acceptable? Alex, I think, hasn't spoken in a while.
Yeah,
So
go on.
can we go to Alex? So how can we make this more acceptable so we get more people who aren't already sold on the idea of medical cannabis?
Perhaps the way that it's presented, just going back to that original question, when I'm reading up about a particular flower, there's a company I like because they go on to describe perhaps the effect that it might have, and that's really, really useful. So, you know, the strange names that we've got, Ken Dog and, you know, various other things.
Really
Yes, things could be named in a way that doesn't make it sound so adolescent. You know, potentially we could be doing that, couldn't we? We could be presenting the flower in a less jovial way that would allow people to see that it's quite serious. Do you know? And the way that it's described, I mean, it's wonderful that it's, you know, lemony and delicious and, you know, and not harsh in the throat. But actually, when trying to research something with the limited information that you have, that's actually going to go on and affect your month, you're committed to the flower that you choose or the product that you have for that month. You know, you know, especially in my case, it's a really difficult decision to make. And perhaps if the way that it's presented is that, you know, it is flower, but it's not like a beer can, where we're talking about having a pleasurable experience as a result of choosing the pink packaging and, you know, and the name that's attractive. And that might create a more serious conversation around the flower that we're using. So,
yeah. I mean, I've always thought, you know, is it wrong to enjoy your meds? And are the two mutually exclusive?
Yeah.
You know, because I know people who have psychotherapy and love it, and you know, they gorge themselves on psychotherapy. They have it every week for years, and they go to it because they enjoy it. Is that wrong of them? Even though they're having a therapy?
Well, this is going to be a really interesting perspective then. I think I've been part of your clinic now for 8 months or so, and the development in you know, in me personally, what I'm able to achieve now to get back into my life is just extraordinary. But you know, working with you, the emails, trying to work out what's just come out of stock, is it the right product? We even went through, I had an indica that actually was a sativa, and what they've done is just put a little note at the bottom saying, oh, this is actually a sativa. Now, for my condition and for my difficulty, I just can't use sativa well, because I can't sleep and I'm thinking, and it's the middle of the night and I'm writing a novel. Now, if I have an indica, then I feel gentle, kind to myself and other people. I can do the washing up, I can look after myself. You know, so the way that things are labelled and presented, I think, is really important, and I don't see enough of it to help me make a proper, you know, to help me make a proper choice. But perhaps that affects how other people see it as well. Well, you're smoking something called car crash. Well, how serious really is your mental health condition that you're?
So a Nurofen and an ibuprofen, pretty much the same thing, but actually, you know, unless you're going down the isolate THC, CBD. It's different and has different effects for every single person. So, yeah, no wonder it's complicated. It's not just one can of medical cannabis, break seal here, there you go. So it is complicated. Are there any other questions from the audience? Has anyone got their hands up? We want to try and at least, I can't see past this door, but anyone on that side? No? Okay, we can continue talking amongst ourselves. So, Umesh, I think silly names you were talking about. Do you have a personal opinion? Do you think that silly names undermines the seriousness of what you do?
Yeah, I think that's a huge point. I think earlier on we were talking about how do you make it more acceptable, and I think, yeah, the silly names. I think we're trying to get into the sort of medical cannabis arena, but a lot of the guys are still using what effectively are names that they're using on the recreational market, and I think that's a real issue. I think, again, this is about agencies not really talking to each other, and I think there should be somewhere where we should be starting to to put in an almost national formulary to say, look, you know, these are the drugs and these are how they should be presented. And I think the MHRA does need to take a bigger stand. I mean, currently what they're trying to do is they're trying to restrict sort of silly names. But what everyone's doing is they're abbreviating their names. Now, about 4 different companies make Pink Kush. Now I've got 4 products on the shelf from different companies called PK. All of them have different strengths, have grown different. I mean, we know this. Even if it's the same strain, if it's grown slightly differently, it's going to be a different plant almost, yeah? So, you know, what do I do with that information? I can't do anything. You know, hence why, like I said, the Farm Stock wants us to use strain names, or they should be on the prescriptions at least, so we can define what's happening. But the reality is, I think, you know, the MHRA should be saying, look, you know what, if you're going to give the strain a name, give it something else. In Portugal, they actually do use different names for their strains, and they do make it sound a bit, you know, very different, rather than using a popular name. Sorry, this is just one company I went to, but I'm not sure if everyone else is. But yeah, that just seems quite understandable, personally. So
Okay.
I think that's a key one. On the point that you made up about not having enough information, the problem is something called the Blue Guide with the MHRA, where if it's an unlicensed product, you can't make unsubstantiated clinical claims. So that's going to be the biggest hurdle to that. And again, that's a hurdle to getting that product out to patients with more information about what it will help them.
There's an awful lot of bro science out there. If you go on Reddit, then you know they're the terp experts who love their gassy, non-irradiated products, and yeah. As a doctor, you can't make any claims that you can't back up and substantiate by evidence. So, what you're looking at is a bud tender from a Canadian store, and I'm sure there's a role for it, but it's probably not at medicine in the evidence base we've got at the moment. Is there anyone else wants to make a comment? We've got 10 minutes left, and we want 5 minutes for a last question. So,
I was just going to say, I mean, in terms of the brand names, it makes absolutely no difference to me at all. As a patient, I don't think it should make any difference. I think personally, the normal strain names are actually better because people will be able to Google it. You know, let's not convince ourselves that we live in a kind of, as I say, live on an island. We obviously do, but you know what I mean. Yeah, medical cannabis is consumed around the world. So if we start to adopt our own terms and definitions, I think that would actually add confusion. Because people will still Google stuff on the internet, and instead what they will find is there will be stuff that is then specific to the UK, which might not be applicable to the rest of the world. And so I think that people might then get confused. And also if you're a producer, well, it's not all produced in the UK, so you then need to have different possible regulations just for a UK market, which would then increase the prices potentially for consumers. For personally, I don't think for changing a name, it doesn't make any difference. I'm quite happy to say that I use Gorilla Glue to help me get to sleep. It sounds ridiculous, but the reality is that what it's called has absolutely no impact on the medical effect it has on me. So personally, for me, it's not really an issue. I think there was one other thing I was going to say as well, just going back to one of your previous points in terms of, you know, who do we need to kind of convince in terms of medical cannabis. I don't just think it's the general public. I actually think it's academia as well. I think that, going back to what you were saying before in terms of prohibition, when you think about the sort of social stigma that there has been over the last 100 years or so, what that's actually meant is because of the social stigma, there then wasn't the appropriate amount of scientific studies that were performed over the years. You know, as science developed and advanced, our knowledge and understanding of cannabis as a medication didn't really increase through that time. And so I feel like now we need to actually try and play catch up from the research side. And I think that certainly within academia, if you think about something like cannabis, we're all here saying how wonderful it is, but we will know that in certain instances, if you have certain predispositions to schizophrenia or psychosis, in some cases, it can make that worse. And I think that from an academic point of view, we need to be mindful that the things that give a lot of people benefits will make certain people's conditions ever so slightly worse. And so there will be an academic disagreement there between people who say, yes, we should use this, look at all of the positive effects it's having, and then you will have another group of researchers who go, yes, but actually we need to think about
And
this.
that's the balance we deal with every day in clinical medicine, in academia. So yeah, totally agree that that's going to be the case. And at the same time, that's going to hit the headlines at some point. We know it, people are being prescribed things, something's going to go wrong, even if it's not related to the cannabis, it will hit the headlines. So we're all kind of bracing for the day that happens. Numbers increase, it will. As a final question for all of you, and if we start with Guy, so Medical Cannabis Awareness Week, 6th iteration by the 7th, so next year, what one positive step would you like to see within the medical cannabis world and or within your own world?
Can I have two things?
Only if you do them both in half the time you would otherwise.
Yeah. I would like to see cannabis decriminalised in the UK. So that would be actually moving it from Schedule 1, Schedule 2 in the regulations down to, say, Schedule 4, Schedule 5, which would change a lot of things, allow GPs to prescribe, it would, you know, make it accessible, make people be able to grow their own if they needed to. And the other side would be the MHRA to actually put in a new policy for natural medicine, because this is going to come out with psychedelics as well, where there's a lot of research for mental health and things. And you can't put natural medicine in the same box as pharmaceuticals.
I think there's all sorts of potential there, so I totally
So I think those are the two things I'd like to see.
Rachel, so is there a positive that you'd like to see or a problem solved within the next 12 months?
I would like the government and the establishments, i.e. NICE, MHRA, the BPNA, the ABN, all to come on board with it, because ultimately these are new medicines coming through and they have to look at them in a different way, and it all has to be managed in a different way, like we've just been discussing. Let's get on board like the other countries where we have a medical cannabis directorate or a department where the education can start from there, you know, because Bailey's never going to have a prescription in his lifetime, and I've always said that because we are so far behind realising it and adopting it as a medicine. There are so many barriers in place, but I would love to see everybody come on board with it and all those departments.
And I think you're right, looking globally rather than just on what we're doing here and fit that into the jigsaw. Leon, 12 months, one positive and or removal of an obstacle?
I think one thing that I'd like to see would just be a slight improvement in the supply chains. I think one of my biggest probably bugbears, it's probably the only one to be honest with you, is when you have that time of the month where you choose which strains you want, and it's almost like you will find a strain that will work, but then you'll suddenly find it goes out of stock. And so you'll then have to then pick an alternative, and then you don't really know what the effects of that will be, and you're kind of guessing based on, you know, the THC content or the genetics or the lineage.
Over time, you've got to be the expert patient in your own right.
Yeah.
And
so
not everybody has the will, desire, or experience to do that. So yeah.
Exactly.
Alex.
I'm always interested in numbers, so I'd quite like to see the money that could be saved on the NHS for other ailments or ongoing use of pharmacological medicine that creates renal damage and kidney failure and liver dysfunction, all the things that I was told would happen to me if I continued to take lithium, for example, which was a massive factor in informing my decision. But could we look at some numbers here, and could somebody actually plot this out and say, well, we think you might save X billion if you were able to offer these people this alternative, and initially, if we have to fund it, then yes, we would go ahead and fund it privately. But numbers, I'd like to see it as a bar graph or some kind of a pie chart, and I think that would have some impact.
Some actuarial data.
Yes.
Absolutely. I'm sure it's possible. It's just the will to do it. So. Umesh, I'm sure this could be a long list, but please keep it very narrow. What one thing that would make your life easier and the world a better place?
I think, so I've come, and I'll be quite honest with you, when I first opened up the pharmacy, I was quite sceptical about medical cannabis. And one of the best things that happened to me, it wasn't the best thing, but my first 2 years COVID hit. So I was actually very close to my patients and I could talk to them. And you know, and it turned my whole understanding about medical cannabis around. So I think if I wanted one thing, I think we need to have our medical professionals, and I'm not just talking about doctors, I'm also talking about nurses, pharmacists, all of them on board. So there needs to be some sort of initiative where, you know, training is provided, more information is given there. I think, and Dave will mark me right or wrong, I think currently there's 22,000 consultants on the specialist register and about only 130 are prescribing.
I think there's more like 40,000, but not all of those would be in professions where they could prescribe.
Yeah, so there's a large, you know, so we talk about holding access to GPs. There's a large number of people who can actually prescribe it, but don't currently because they've not had the experience or they've not been educated to that. And I think, you know, if that was the one wish, I think that would be, and like I said, not just doctors, but all medical professionals, because they all have a part to inform patients. So.
Okay. Well, thank you everybody for being on the panel. Thank you to the audience for listening patiently and not hurling empty pots of cannabis at us. And thank you to anyone who's watching on Instagram. We will be taking more questions, so if anyone does want to have a question, then please do let us know. But otherwise, thank you to Guy, Richard, Leon, Alex, and Okay, so do we have any questions from the audience at this point? No. We've got another one from the young lady down there.
I'm just wondering, I heard something and I'm just wondering if you would know whether it's true. Is it true that there are no prescribing paediatricians in the UK?
Is it true that there's no prescribing paediatricians in the UK? Rachel, do you want to take that one?
From my knowledge, there are no paediatricians prescribing. Their books are closed. Various reasons. There are lots of. I mean, when the law changed and we hit the campaign, there was lots and lots of other families we were in contact with, and they saw the positive effects that our children were having. At the beginning, there was only one prescriber, and that was at Portland Hospital. She retired, and then it was the whole medical cannabis clinics opened. Again, there was only one prescriber. So then, you know, it was a case of educating doctors. If you're on the specialist register, you're allowed to prescribe. And I think back then it was really, really difficult. But now the influx is just so much now that they've had to close the books because there's only, I think there was 2 prescribing doctors now, and they've had to close the books, which is really sad because there's lots of children suffering out there. They've hit the benchmark of nothing else is going to work for them. And ultimately, like with Bailey, we hit that point, and during lockdown when we couldn't get our prescription imported, it was palliative care, and the argument to us was, so you would not prescribe a medical cannabis against palliative care.
I know, that's
and you know, when you're faced with that, you go to the ends of the earth for your child. So, you know, we went fundraising, but that money ran out because we were going to the pharmacy handing over like £2,000. So I actually went out to the Netherlands and brought his prescription back because I got 4 months to the 1 month here in the UK. So I brought that back illegally. Had I been caught, it would have been confiscated for me. But I went out there with an MP, and we've got huge support in that area across parties that we've accumulated over the years.
Well, it's
so I think
you have
just
that
keeping,
political support.
I mean, she was amazing. A Welsh MP as well. But I think the support that we have got in government is great, but is hitting that right person and making them aware. And like you say, over the years we've had just such a mix-up of government officials, and they're all changing their positions within health, you know, and it is quite sad, and it does, because they can't afford to keep funding it. We haven't got no money for this month's prescription, so, you know, it's hard.
And you're not the only parent doing the
No.
right legally to Holland.
Yeah.
It's outrageous.
And there is a lack of support from the professional bodies, like you mentioned, the BPNA, the British
They just put
Paediatric
barriers in the way. I
Association.
mean, I'll give you one
And
instance.
without that support, us doctors feel very nervous about going against our own
Yeah.
professional bodies.
I mean, when we were asking the consultant to prescribe for Bailey, Epidiolex wasn't even licensed then either, but we were offered that rather
Yeah.
than prescribed is full extract cannabis oil. And she said, you know, I can't write the prescription because I helped break the BPNA guidelines and I can't go back on that now. So there's a lot of, you know, there is a lot of...
I'd certainly recommend that we all get, you know, raffle tickets. There's great prizes and it's going to a great cause. So is there anyone else who wants to pass comment on that, or do we have any other questions from the audience? No? That's fine. I'd say you know who we are now, so if you do want to catch us around after this, then please do so. But otherwise, thank you to Low Lounge, thank you to everybody on the panel, and from us at Cannabis Clinic Cardiff, thank you for coming here today. It's been a great event, and we look forward to having many more with you.